Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
I'm WVUA 23's Ashley Berry, and welcome back to Health Matters. Today I am here with Dr. Jane Weida, who is a family physician and professor of family medicine at University Medical Center. Thanks for being here, Dr. Weida.
It's my
pleasure.
Today
we are going to be discussing the disease measles. Can you just start by telling us, why is it making headlines again, and what exactly is it?
Well, measles is caused by a virus, one of the most contagious viruses that we have. And the reason that it's making a resurgence is that some people are really reluctant these days to get immunizations or vaccinations for things like measles. There was a study many years ago in the United Kingdom that said that there was a correlation between measles vaccination and autism, and that has been disproven over and over again. But unfortunately, some people still remember that and believe it.
Mm-hmm. And why is this disease more serious than your typical rash or illness?
Mm-hmm. Well, it can make people very sick, particularly very young people and very old people. And it can come with a fever of as high as 104, a widespread rash, coughing, terrible runny nose, and watery red eyes. And about 1 in 1,000 people that get measles actually die.
Mm-hmm. And we know it's a very contagious disease.
It's very contagious. If someone has measles and is in a room, that measles virus stays in the air for 2 hours. So if somebody comes into that room and they aren't immune, they can catch it in that room.
Mm-hmm. And I've read about some pretty severe complications like brain swelling and things like that. Who's most at risk for that?
Who's most at risk, again, is the very young and the very old and people who are immunocompromised. So one thing that's important is even if you don't think that you might be at risk, if you caught measles and you spread it to someone who is at risk, then they could get really, really sick.
Mm-hmm. And where are we seeing this problem the most right now? Are we seeing it in Alabama?
The last I looked was just a couple of days ago. We haven't had an outbreak yet in Alabama. There's a big cluster in South Carolina, and there was a big cluster in Texas, which is actually tapering off now. But they're in certain pockets of places where there aren't as many people who are immunized.
Mm-hmm. And what would you say to parents who are hesitant about the vaccine? I know you spoke about some misconceptions about it. What would you say to them? It's
a very safe vaccine, and you don't get it until you're 12 to 15 months old, so your body is old enough to mount a good immune response. If you are, say, traveling someplace where there's a measles outbreak, your baby can actually get it at 6 months, can get the immunization. Again, it's very, very safe, and it's much safer than catching the measles.
And how can people in the community protect themselves? Should they advocate for other people to get this vaccine? Of course, get it themselves. Is there anything that they can do?
Both of those things. If they can tell people that they got the vaccine and they were perfectly fine. 2 doses of the vaccine is about 97 to 99% effective. So if you are immunized with 2 doses, you're very, very unlikely to catch the measles. So if we can have people that say, I was immunized, I did fine, I haven't caught it, my children haven't caught it, I've immunized them, and they're doing fine. I think word of mouth like that is one of the best prevention measures.
What do you think causes these misconceptions about vaccines?
I think that probably it starts when somebody like Dr. Wakefield in the United Kingdom publishes something that is absolutely fraudulent. He made up the data, he was anti-vaccine. And when somebody does that, it's amplified on social media now. And unfortunately, people will believe that instead of believing their healthcare clinician.
And how quickly can a single case of measles turn into this big outbreak?
It doesn't take very long. The incubation period is only about 14 days or so. So if you are exposed and if the immunity rate in the community is less than 95%, then it won't take long for it to really spread.
What should someone do if they think that they've been exposed to measles? Is there someone they should call right away?
Well, they need to call their doctor and talk to them and talk about their risk factors and how they the exposure was. If it was an exposure where they weren't close to somebody and they weren't in the same room and that sort of thing, they're probably going to be fine. Most people who were born before 1957 are considered immune because they caught measles as children. And if you've had 2 vaccines, then you are almost certainly not going to catch it.
And do you think, this lack of trust in healthcare professionals and vaccinations, does this have something to do with the rise of technology, social media, or is this something we've seen for a long time?
We haven't seen it nearly as much as we do now. I mean, the fraudulent study was published in 1988 or 98, I'm sorry, 88. And and it was there for 12 years before it was retracted. So it didn't make the rounds in the 1980s and 1990s the way it is now because we weren't on Facebook and the social media Googlers who don't really know that what they're saying isn't true.
And have you actually seen a case yourself in person?
I did see a case when I was an intern. A 17-year-old male had come in from his doctor's office, sure that he had the measles. And I had it when I was little, so I kind of remember what it looked like. And the infectious disease doctor didn't believe me, and he went in and came out, he said, he's got the measles. Sure enough, he had all the classic signs.
That's quite something to see as an intern,
yes.
I'm sure. Yes, and for people watching, can they get help for measles here in Tuscaloosa where you work?
You can always go to the Tuscaloosa County Health Department and vaccinated. Your healthcare clinician definitely has measles, mumps, and rubella vaccine in their office. We don't give a single dose for just measles. Used to be, many years ago, we only gave 1 MMR shot, measles, mumps, rubella. And then if for a while it was, let's just repeat the measles vaccine, but we found that we should repeat all 3. So now, once you get the MMR shot, you can get another one. If you've never had it and you're worried, you can get one now, and you can get one at least 4 weeks later.
Well, we appreciate you being here and sharing this information.
Absolutely. It's wonderful to be here. Thank you for having me.